I'm so excited to give the Community Champion Award to Allies for Health and Wellbeing because of all the great work they have done removing the barriers and stigmas to healthcare. One of the core goals of Allies for Health and Wellbeing is the prevention of the spread of HIV. Through their mobile testing and their on-site support, they can provide the care that is needed. They offer so many different services. Primary care, the food pantry, housing, whatever the patient might need at that point. They meet people where they are.
Allies for Health and Wellbeing is a stigma-free, non-judgmental space for people to get comprehensive health services in terms of gender-affirming care, LGBTQ competent care, women's health care, and primary care, along with the supportive services that we provide for people that are living with HIV. Anybody can come to Allies. It's a pretty unique space. We were formed in 1985 out of a health study called the Pitt Men's Study, which is the longest, oldest men's HIV/AIDS study in the country. And we were developed to help people navigate being diagnosed with HIV and AIDS, but initially to help people die with dignity. It's an honor to have that carry on. There is no vaccine for HIV yet, but with the tools that we have, we can make a really big impact. It's preventable and treatable, and we need to continue to get that message out there.
As the community health manager, I coordinate a team of 4 health advocates who go out into the community, offering education, offering testing. We offer testing at our own office in East Liberty, and we also take our van out wherever we can. What made you decide to get tested today?
I've never been tested before.
Oh, that's an awesome reason. It's a good idea to get tested for HIV, syphilis, hepatitis C, chlamydia, and gonorrhea at least once in your life. We do focus a lot of energy and attention on sexual and gender minorities and also ethnic and racial minorities. And that's because these communities can often be left out of health messaging or people having negative experiences directly with providers. Okay, this might sting a little bit. So what we do is try to create an understanding of what HIV is, how to prevent getting sexually transmitted infections, and to provide a friendly face to a process that can be intimidating for a lot of people. All right, there you are. You are very welcome, thank you. It's huge, I love what we do.
We cover 11 counties. We touched about 900 individuals last year in terms of case management. And those case management services cover helping people stay on top of their medical care, getting to medical appointments.
So this is our food pantry here at Allies. Food insecurity is a huge issue for people, and so we want to be able to provide food security so that you can focus on other things like getting to your medical appointments. For people to try to meet any level of their best self or their goals, we have to remove some of the barriers with them. Some of the services that we offer are food pantry, referrals for housing that will help them decrease their rent payments every month for the rest of their lives, help with utility bills when they're at risk of being shut off to make sure that everybody keeps their lights on and their heat on. We offer a lot of assistance with mental health. So that can be a referral in-house to one of our 2 therapists, or it can be out of house. We have a pharmacy that assists people with all the payments for all of their medications, whether they're covered by their insurance or not. Any one of us can be a person living with HIV. It does not discriminate. What we're doing is basic human services for humans.
We have the tools. PrEP, it's a 1-a-day pill that if you take it every day, it blocks the transmission of HIV. And now, more recently, an injectable called Apretude, which people can take every other month, along with condom use, people that are living with HIV staying undetectable. We can stop HIV. We just need to continue to work hard to make sure that those are in place. Almost 8 years ago, we had about 500 people in our case management program, and now we have almost 900. We're spreading the word and letting people know that we're here for you and we can support you, and we just continue to grow. I've been a social worker for nearly 30 years. And then coming to work for Allies, everyone that I work with is selfless, and they just care so much for the people that we are serving. It's a blessing and such a joy to be part of this organization.